Approximately, yeah.
That one goes around, 2 implants will be around $5,000 to $7,000 around there. We can give you exact figure once because it varies with each person, different. Also, how much bone you have, what type of implant you're supposed to use, it depends. So that's it. Now this thing talks about the grafting, like when you have bone loss, what do we do? So that's what this video is going to talk about, okay?
What changes as far as taking care of them? What will you do different? Anything different?
I didn't even just
Well, I
say.
mean, you still brush, you floss.
Oh yes, you have to, there are special toothbrushes, so special flosses are out there, and you have to use a special kind of mouthwash. When you have implants in your mouth, you do everything what you're doing for a natural teeth, but there's some additional thing you have to do for your implants too. There are special cleaning brushes out there which you can use for this. So there's and of course you have to.
Prescription mouthwash?
Yeah, it's a prescription mouthwash, and usually your dentist or the person who places an implant gets this one. And there are special syringes. There's water pick. You can use water pick. Water pick is something like a jet wash that's like we can buy from Costco. Costco usually have very good deals. Water pick is very important for implants, even for your natural teeth too.
And that's for life.
That's sorry.
For life, you do that.
Yeah, the way you do it for your natural teeth, you have to. And of course, you have to visit your dentist every 4 to 6 months for your professional cleaning too. It's a maintenance period, yeah, you have to do it. Any more questions, anything?
Yes,
Yes, go ahead.
I don't know if I have the sequence right here.
That's all
I'm
right.
assuming that my dentist did a root canal, put a post in, and put a cap on the tooth. Now the cap has come off, and now he's telling me that I have to, he says he can't put another cap back on the same post, which I don't understand why, but whatever. So he says that has to come out. And so then my question then is, I'm assuming that this has to be done sequentially, that post has to come out, it has to heal, and then you start the root, the other thing? The tooth implant?
Now, when you said post has to come out, that means the tooth has to come out or the
The
post?
cap is off, but
Yeah.
the only thing is left is the post. He
Post,
says
yeah.
the post has to come out.
So then what is his next? Because post is different from the tooth. The tooth is still in there. If he takes out the post, he can place a new post and put a new crown on it. Means I don't know exactly. Maybe he says that the whole tooth has to come out and then place
There's
an
no
implant.
tooth left.
There's no
only,
tooth.
there's only a post left.
Yeah.
There used to be a crown on that post, but the crown came off.
Right,
So there's only a post left. There's no tooth left whatsoever.
right.
And he's telling me he can't put a new crown on that post. You know, his thing is, well, we put a bridge on it. I've been there, done that, I'm not doing that again.
Right. So what you can do, there are two ways. Say once you take out that post, you can place an implant on the same day too, or you can do the bone grafting like the socket preservation, and then after 4 to 6 months you can place an implant in that way. Now it depends, it's a front tooth or the back tooth.
Back to,
So back tooth, you can afford to wait 4 to 6 months because it's not visible, let the bone heal and place an implant at that point. That will be ideal. But nowadays you can place an implant on the same day too, when you take out the tooth.
okay, so ideally then, I have the oral surgeon take out the post, let it heal,
Then,
and then get the implant.
yeah, you should get the bone graft done too. Once you take out the tooth, there will be a space in your gums that has to be filled with the bone graft. So you have to do grafting too. If you want to place an implant in future, I would suggest get that bone grafting done too.
So there's no way to fill that hole up with the implant tooth.
You can do the same, yeah, you can place an implant on the same day, but again, as I said, there's a 10% higher failure rate if you do it on the same day.
I see, okay.
So if you want to want the implant to last longer, just wait 6 months. Let it heal then.
this, do you use the same teeth whitening procedures with the
Implanting.
implants as you do?
No, you don't, you cannot whiten those teeth. Any artificial teeth, irrespective of implants or bridge, you cannot use, they cannot, you cannot make them white at all. Only natural teeth can be whitened. So these are the some models.
Symmetrical gum.
We have some model. This is like a bar supported dentures if you want to feel it how the retention is, and then this is a bridge which is supported by implant.
My bridge is fixed. It's very permanent.
Yeah.
I can't detach it.
No, this is also fixed. This is just for the showing,
Oh,
just for
okay.
showing water
Oh,
purpose.
okay.
Yeah. So this is it's usually in mouth is cemented. This is just to show how it is. You want to have a look?
Yeah. Mortgage my house.
And that's the partial denture of the two implants, which is clicking over there. So this is a removal option, this is a fixed option.
And this would obviously be cheaper than this.
Because there are only two implants for so many teeth. When you only have three teeth, there's three implants.
If you can bite and work, these will still, these can.
But the chewing, biting force will be very high on this company. This way it's naturally going to be two implants with one implant.
Do you do all types of dentistry, or you just specialize in
I
this?
specialize in this, but I do other dentistry too. I had training from England and India and over here. So I have training in oral surgery, I have training in prosthodontics and implantology. So I have training in all the three fields. Usually what happens is that when you go to a dentist, they refer you to oral surgeon to place an implant. Then you'll come back to your dentist and he will place a tooth on that implant. I do everything in my office.
After you do the surgery?
Surgery
you
as
pull
well.
out the teeth and everything?
Yeah, everything.
Oh, everything?
Everything in the one roof, yeah.
Oh.
Because I have training in both, so it helps to plan the treatment very well. Otherwise, if there's any communication gap between oral surgeon and dentist, then problem can happen. Treatment has basically, when I took out and I place an implant, I know where my teeth will go, and that's where I'm going to place an implant. Whereas when oral surgeon does it, he just places an implant where the bone is, and then gives to the dentist, and dentist has to then put the tooth on.
Well, again, maybe I'm out of line, but I've had some very bad experience with dental work here. I did have some dental work in Mexico,
Uh-huh.
and I'll be honest, I felt I was treated better. It wasn't perfect, but I felt I got better, more personalized treatment. It's the first time I ever had those radial x-rays. People, were cringing when I went there. But all the x-rays I had here, you put the things in your mouth and you gag.
No, we have the other X-rays
Radio,
too.
and
And
then,
now, for the implants, you have to go for a third type of X-ray called CT scan. Like, if you're doing one tooth, that's fine. If you're doing multiple teeth, I would advise to get the CT scan done.
well, I never had Novocaine here.
Uh-huh.
You couldn't feel your jaw, but I would still feel the drilling. I go there, I'd have,
Didn't feel anything.
they did 8 root canals at one time, and I didn't feel
Okay.
anything. And I never had that in all the years here.
You are very lucky that, I had few patients who went to Mexico because they could not afford treatment over here. They got the treatment done, and then they came back after 2 years. They spent twice the money to repair what was
Repair what was done.
It was a lot of damage was done.
Do you have a
So
payment plan? So
We have a third-party payment plans, yes, in our
Third
office.
party will,
Events like care credit, so you can apply to them, and then you can borrow money from them, and then you pay to them every monthly payment.
not direct.
We don't do directly. We don't have that much of manpower to do it directly. Yeah, so coming back to but you were very lucky then. Yeah. I know about at least 3 children who had bad
Well,
experience.
can you tell what they didn't do right, or what wasn't done?
One was the implant treatment, and they didn't place the right kind of implant. And one patient, he had so much of infection that we had to send the patient to ENT surgeon to get the infection out. He had to put him to sleep to do everything, and still very chronic sinus infection.
I didn't have any implants
so-
there, I just
Oh, okay.
root canal and some extractions.
Uh-huh.
You know.
But it doesn't mean that everybody in Mexico is bad. If you get a good dentist who is conscientious, who is ethical, who is good, then yes.
What's the difference between root canal and implant? Isn't it about the same thing?
Root canal is a natural tooth. Root canal treatment you do in a natural tooth. Now, implant is which replaces your natural tooth. Root canal is, say you got so much of infection in your tooth, you had a cavity which went all the way within the nerve of the tooth. Like you have a picture here. This is a tooth and this is a pulp. That's a nerve. So when you get a cavity, it goes all the way here. So infection will spread throughout all the way to the root. So this part of the tooth, it's actually very soft. So what we do is make a hole through the tooth and take out this part of the tooth and shape this. Basically, it travels in the canal of the root, so you have to kind of shape the canal. So it's called root canal treatment.
I think the one time I went to have it looked at, and there's mention of root canal, and going to the oral surgeons, and going to have cleaning done, and there were very bits and pieces, and I wasn't too pleased with
What
that.
bothers me about here is it's like one person doesn't do it all.
Yeah,
You know?
you want that.
That's why in my office I do everything. So that only thing I don't do is
Where
braces.
is your office located?
It's in Oakley. It's right here.
What is the MDS distinction?
Master of Dental Surgery. That's the prosthodontist. That's my master's in prosthetic dentistry.
So are you like an oral surgeon then too?
Yes, I had oral surgery training from England for 4 years. So I am oral surgeon, but I didn't have training in America.
Do you have to be licensed in the U.S.
Yes, I
based on
am.
the U.K.
No, I have to go
masters?
through the training again.
So you had to take a test.
Yes, yes.
I mean, driving on the left is difficult enough.
Absolutely right. Absolutely right. Yeah, I went through training, everything here. Basically, my implant training is from the US. From America. I used to do implants in England too, but after coming here, I did my fellowship in implantology.
Where did you do your dentistry in London? Did you do it in London?
No, I did it from Edinburgh, Royal College of Edinburgh. Basically, in India, I became a dentist and I did masters in India in prosthetic dentistry. Then I moved to England where I did oral surgery residency and I got fellowship in dental surgery from Royal College of Edinburgh. Then I came here, I got my license and then I did the fellowship in implantology. So I've been doing since became a dentist in 1990. So.
When you were just a little boy.
We like that comment.
How could you reach so high?
Pretty tall.
Well, we lived in London for 35 years.
Oh, you did? Oh, okay.
And I taught many Patels MBAs.
Oh, okay. I was in Peterborough. I did Peterborough, near Cambridge. Yeah.